Howdy folks, and welcome back to Healthy Humor. I'm your host, Doc MB, and with me today is my very good friend, Hannah Riegel, athletic trainer. She has Riegel Athletic Therapy, but she also has a day job. So to start us off, I'd like to ask about your day job before we talk about Riegel Athletic Therapy. Also, if you forget the name of her company, just look at our shirts.
Yeah, absolutely. So right now, my full-time job is with a company called Select Medical. It's a big conglomerate hospital company, and one of their umbrellas under that is called Work Strategies, which is an industrial injury prevention company. So they focus on contracting out to larger companies that want to save money in regards to their employees' health and workers' comp cases. So I work for a large U.S. airline, or contracted to a large U.S. airline in the area that has a maintenance base. The maintenance base has anywhere at any time between 4,000 to 6,000 employees. So it's a very large employer, and it's a very physical job, as you can imagine, at an airline maintenance base. So we're on site, full-time contractors for the employees there, and they can come see us for any injury that happens at home or at work, which is really nice, because to our company it doesn't matter how they got hurt. A lot of injury prevention companies have to specify that it happened at work. What's nice about ours is we don't have to, so we can help you with whatever problem you're having.
Right.
And yeah, we do injury prevention there. We do a lot of education.
Okay.
We do a lot of ergonomics.
Yeah.
We do work risk analysis.
For people who may not know the word ergonomics.
Yes.
Yeah. So,
Ergonomics is a way to perform a job properly, for like the best, easiest definition of that. So how to set yourself up, how to set your body up, and how to perform a job task properly without hurting yourself. And so even though there's a lot of physical job tasks out at this base, there are a lot of desk workers too. So we do workstation analysis. So if you want your desk properly set up with your equipment that you have available, whether it's a sit-to-stand desk or just a sit-to-stand lap desk or whatever it is, we can come set you up, set your chair up properly for your height and weight, and the desk as well, so you're not inadvertently hurting yourself doing the thing you have to do every day.
Yeah.
And we also do work risk analysis, and that's more on the more physical jobs typically. If an injury occurs doing a job task, the supervisor might ask us to come out and analyze that job task and see if with us, along with, we might get safety team involved, we might get the engineers involved, to see how we can make that job tool or job task or part they're working on easier to handle, easier to perform their job task without hurting themselves.
Okay.
Yeah.
So that's the day job.
Yes.
That's where you're at now.
Yeah.
And then outside of that,
Yes.
you have Riegel Athletic Therapy.
I do.
Okay. So what are you doing with Riegel Athletic Therapy?
So Riegel Athletic Therapy started by the fact that, one, I do a lot of side work. So I do a lot of side gigs, and I was like, why not make my own LLC? Yeah. Why not put my name on it? So I started that in the middle of 2024, last year. And right now, I've been mostly focusing on event coverage. Okay. So I seek out any event, team, or brand that needs an athletic trainer in the area. So I have worked with several sports teams, athletic complexes and stuff like that, anywhere from the Titan Sports Complex I've done gigs at. I work with BMX, USA BMX here in town. Currently, I'm working at a local high school to fill in for an athletic trainer who's out on medical leave. So I'm doing a lot of mostly event coverages. So that ranges from a lot of different sports and a lot of different age groups. I also take individual clients. That's not the bulk of my work right now, but I also, I'm always taking individual clients that are wanting to have an athletic trainer come to their home. I'm a mobile service, so I can evaluate you and treat you right there in your own home. And so, yeah.
So I want to talk about the kinds of treatments that you do.
Yeah.
But before we do that, will you just share what an athletic trainer is?
Yes.
Because I feel like there can be a lot of confusion.
Super a lot of misconceptions and confusions about athletic trainers. I think it starts from the name, right? So like trainer is kind of a misconception in general because people tend to think right off the bat that we train people in strength conditioning, which a lot of athletic trainers have a certified strength and conditioning specialist certification, which is a CSCS. I don't. I have a general knowledge of it, but I'm not a CSCS. So I'm not a personal trainer. And so athletic trainers are multi-skilled, highly skilled, faceted healthcare professionals. We specialize in prevention. We specialize in evaluation, diagnosis, treatment, and rehabilitation. And that can be from any injury, from like emergent injury, acute injury, and chronic conditions.
Gotcha.
So a very antiquated, not antiquated because it's still very applicable, description is we see injury from the time it happens. So on the field, injury to return to play.
Gotcha.
So from A to Z all the way through, we see that person through in the traditional sense. That's what we do.
Right. But then where you're at now, it's more of you see it through injury and then it's return to work, not return to play.
Exactly. We see a lot of return to work people, especially when they're returning from work from a surgery or returning from a physical therapy program they did outside of work. It's super different, obviously. It's a different patient population. Industrial injury prevention is one of the facets of athletic training that's growing really fast. And there's a lot of people gravitating towards that for a lot of reasons. One, it kind of gives you a more work-life balance, being it's shift-based, so you know you're going to be there from A time to B time. You know that's your shift, and it's consistent, whereas athletics is not as consistent as that.
No.
And then larger companies are paying more.
Yeah.
Yeah.
And I mean, that work-life balance and knowing that you have the shift and stuff, and then you're also not traveling, right? And you don't have to go to away games and be gone and do a tournament for however long and come back. So
yeah,
it's definitely a lot. It's a lot easier for me to see you as a friend. So
Yes.
I appreciate the change that you made. But
yeah, I'm able to control my schedule a lot more, obviously, and then I'm able to do fun stuff like this, like Riegel Athletic Therapy.
Yeah. I thought you meant being on the podcast, but
That too.
Yeah. So the scope of an athletic trainer, though.
Yes.
You mentioned the treatments.
Yeah.
But if someone has never utilized an athletic trainer, they might not know what an athletic trainer can do.
Right.
And I know that obviously, like, you have extra certifications and extra modalities.
Right.
Treatment types.
Yes.
But what's the normal scope, and then what are the additional, certifications that an athletic trainer can get?
The profession itself and the scope of practice has changed quite a bit, even since when I was in school.
Okay.
So I've been certified since 2018, and a certified meaning board certified by the Board of Certification. And back when I was in school, it was a bachelor's degree. So I have a bachelor's in athletic training, and then I pursued a master's secondarily. But the base education for an athletic trainer now is a master's of athletic training. And so that scope of practice has changed just based on that because the education system has changed. So the accreditation program, which is CATE, CAATE, has changed their scope of education.
Okay.
So there are things that athletic trainers are learning in school that I had to take, if I wanted to learn, had to take an extra certification when I got out of school. So things that are included now that weren't necessarily when I was in school were things such as IVs and suturing.
Oh. Okay.
And those type of emergent care that, as long as your supervising physician, your overseeing physician, allows you to do and thinks you're competent in, and it's within the scope of practice of your state that you practice in, and you're certified, obviously, and you're good standing with licensure and your physician, you can perform those duties.
Okay.
I have a couple extra certifications that I pursued outside of athletic training. So I'm also an EMT. I'm a national registered EMT, which is great for emergent conditions and acute conditions, obviously.
Right.
Triaging, that type of thing, traumatic injury that we see. And then I also am certified in dry needling, which is very similar to acupuncture. But yeah, there's tons of certifications that you can get. There's so many continuing education courses you can pursue as an athletic trainer, and it's never ending. Honestly, you can. There's not necessarily specialties within the athletic training, like official specialties, but there are definitely things you can specialize in. And become very competent in. I know people who specialize in concussion evaluation, treatment, rehabilitation. I know people. I wouldn't say I'm a specialist in it, but I tend to focus more on manual therapies. So soft tissue mobilization, joint mobilization, and just soft tissue treatments such as dry needling.
Okay. So I kind of want to go back to this because I find it really interesting whenever a certifying agency or body wants to change things.
Oh, yeah.
And I always like to know why they want to change it. And I have a theory, which is, especially in states like Oklahoma, where we are incredibly rural, is it because there are so many towns where the athletic trainer might be the main healthcare professional that someone is seeing, or is it just to give them more ability? I mean, do you know the reason?
I mean, obviously, I'm not within that board, and so I can't speak for them completely. But unfortunately, there are so many rural areas, secondary areas in Oklahoma that have a need for a healthcare professional, obviously, especially for kids in sports, because sports are everywhere. It's like one of the commonalities across our country, right? So youth sports are everywhere, and we need protection for those athletes, and we need someone advocating for them and performing really good care on site. But a lot of secondary schools and clubs, programs, whatever there is, they're still very much lacking that role. So I wouldn't say that athletic trainers are necessarily that prevalent, even in those rural areas, secondary areas. It's becoming better, but there is a big gap. Personally, I think the reason is we wanted to be more recognized as healthcare professionals.
Okay.
That's number one. So, for example, I can't remember what year it happened, but PTs, right? It used to be a master's degree. Physical therapist. It used to be a master's degree of physical therapy. Now it's a doctorate, right? So you have to receive a doctorate of physical therapy to practice as a DPT. Same thing as an athletic trainer. It used to be a bachelor's degree, and now it's progressed to a master's. And that's one. It creates a couple things. It creates just more knowledge about the profession. It creates a higher education level, which then will up salary rates and salary bases. And it just it kind of elevates us in the eyes of other healthcare professionals. Athletic trainers on a daily basis. Doesn't matter what kind of job you're in or what setting you're in, you work with a myriad of other healthcare professionals, and you have to communicate with them. So I think that was the reasoning for the change. We had to grow. We had to grow and to compete with other degrees and other healthcare professionals. Not that it is a competition, but we want to be prevalent, and we want to be seen and equal with other healthcare professionals, because in knowledge, in education, in know-how, in skill, we are. So it's just getting that word out there and getting to know athletic trainers.
Well, and you have a medical license. You are registered and licensed
to practice in your state. Every state except Texas. I don't maybe California. I should probably know that.
We can check it. Put
We
it
can fact check that. You have to be a licensed athletic trainer. So you have to have a medical license within the state. Every state's different of how you apply for that. Mm-hmm. Some require exams, some don't. You obviously have to be in a good standing with your board of certification. Mm-hmm. You have to have an overseeing physician that's also with good standing. So yeah, you have to be a medically licensed professional in the state.
Yeah. So you've done athletics
mm-hmm.
at all levels.
Yeah, anything from high school to D2, D1, youth camps, tournaments, name it. Yeah.
All the way through.
Yeah.
And then now you're in the industrial sector.
Mm-hmm.
And that's an emerging sector for sure.
For sure.
But what other sectors are there? Are there any other big emerging ones? You know, where could someone run into an athletic trainer in the wild?
Yeah. I mean, just in my own, network of people, I'm seeing a lot of people do this.
Okay.
Monetize and put their name on things, which I think is fabulous. I think more people should be doing it. I think athletic trainers should be available to the general public.
Absolutely.
I think that, our skills apply to everyone. So it doesn't have to be an athlete. Mm-hmm. Everyone moves their body, so everyone should have an athletic trainer in their life, I think. So,
that's why.
Yeah.
That and friendship.
Yeah. But, what was the question?
Other emerging settings.
Okay, other emerging settings. So, along with industrial, it kind of goes along with that, helping people do their jobs properly. So you're going to see us, emerge in fire departments within the city. So you're going to see cities hire us for fire departments, for police departments. Mm-hmm. We're already kind of, I would say, military is kind of above industrial, I think, in numbers-wise, or at least they were a little earlier than industrial. Uh-huh. Military athletic trainers were. Unfortunately, right now, there is a movement in the military, a bill that has been trying to pass to remove athletic trainers from the Army specifically. But again, that's new as of this week. So it's still, we're still unsure what's going to happen with that, and hoping for the best for all of my athletic training friends that are in the Army and doing good work there. So, Army cadets and anyone in Army personnel, military personnel, could definitely benefit from us. So, that's another setting that you'll see us. I think that the biggest emerging and is the general population.
Okay. Yeah.
To be honest with you. You're going to see us more in clinics. You're going to see us more doing side businesses and running our own practices. Mm-hmm. But yeah, industrial, and then also within cities. Yeah.
Okay.
For those workers. Yeah.
Go on tour with a band, maybe?
I know people who already do that.
Really?
Performing arts is another one.
Okay.
So, dancing, Cirque du Soleil, any type of performing arts, touring shows, anyone that does physical things, they need an athletic trainer. So there's a lot of people that do liaison work for musicians and bands and stuff like that, especially when they're in towns that they're not familiar with.
Okay.
Yeah.
When you start working for Taylor Swift or Glacier, just I gotta be there. Whenever you are working with clients,
mm-hmm.
right, what are the big misconceptions there that they might have? Or is the average client that you're working with, because they've already come to you, do they have a better idea? How often are you really facing the misconception side?
I would say a lot, honestly. Not as much as when I was initially in school. Maybe I'm just better at explaining it.
Okay.
But I do think that there's still a lot of misconceptions about athletic trainers. The traditional, we're just water boys and girls. We just tape ankles. Those types of things. Mm-hmm. That we're not familiar. I've had family members tell me I'm not a medical professional. Because they don't know. It's just lack of education and knowledge. So, but I would say that generally the clients that I see do know my skill level. Sometimes they might be surprised as how much I can do and how much I can help them.
Okay.
I mean, I've seen clients that are friends that I've had for forever, and they didn't know how much I could help them within 1 or 2 visits.
Right.
And how much you can improve function within that issue you're having.
Yeah.
Just with, 30-minute appointment.
Right.
So.
Okay. So, I kind of actually want to go back to this now. I'm a little all over this today. But, so we talked about, obviously, like, the changes for the scope of practice.
Right.
The emerging settings.
Mm-hmm.
But what about, are there any other are there any other big changes within the profession that you can think of?
I mean, for sure. As someone who's worked in the college setting before, there is a huge movement in specifically school programs. They're moving from what was considered an athletics model or an athletics department model to a medical model.
Okay.
That's a huge change that's happening, especially in larger schools. So that would be considered a athletic trainer or an athletic training staff. Comes in and works for the school. Typically, traditionally, they'd worked for the athletic department, meaning their boss would be the same as the coach's boss, which is the athletic directors, right? So whether it's the assistant athletic director, however your program is functioning.
Okay.
But it is, the kinks are working out of that. There's a lot of conflict of interest within that, right? So as athletic trainers, our number one priority is health and safety of the person we're treating. Whether it's the athlete, of course we want them to be successful in whatever skill they're doing, whatever sport they're doing, whatever they want to perform, whether you're like a weekend warrior or a gardener.
Yeah.
Because I treat every type of person now. We want you to be successful in that. But mostly we want you to have the most healthy and successful future you can have.
Right.
And we see that most obviously in youth sports and younger people. That's what our best interest is the health and safety of their future.
Okay.
And I think that sometimes there is a conflict of interest within athletic departments. So they're moving from more of an athletic model where our bosses would be athletic directors, and moving it to a medical model where we are working under a hospital system instead.
Okay.
What that does for us is it changes who obviously our supervisors are. It changes policy care. It changes how much resources we have. Maybe that hospital system, maybe that medical system has way more resources than the athletic department did.
Okay.
And we can provide higher quality care for that athlete. It also can up your salary. Right? So
That's nice.
it can also offer your staff more continuing education through the hospital system.
Okay.
So it opens up a lot of doors. And not that athletic departments were, some athletic departments are struggling, right? So it does open up a lot of opportunities for athletic trainers in terms of salary, in terms of education, in terms of patient care. So that's awesome.
I love that.
Yeah.
I really do. Okay. Within the profession of athletic training, though, are there things that that people want to see change in, or is it already kind of happening?
I think that it's happening. I think that obviously I can't speak for all athletic trainers or our profession.
Yeah.
I think that it is happening. I think that overall we want the same thing. We want high quality care for our patients. We want to be seen as highly skilled health professionals. I think that at certain levels, specifically within college athletics, secondary schools are a little bit better, but they need to get with the program and pay athletic trainers what they're worth.
Yeah.
I think that's one of the biggest things I've heard from my own community, is that it's not up to par with the care and the time and the effort that we put into our job. And as an athletic trainer in that setting, you have to absolutely love that job to do it. You have to love your athletes. You have to love that type of life. And really buy into it to do it, because it is really, really hard work.
Yeah.
Not for the weak.
So, I guess aside from just really loving the work and obviously having an interest in health and a desire to help people, are there other traits that make someone a really good athletic trainer? Or, like, if someone was interested in going into athletic training and you met them, you'd be able to be like, yeah, you're gonna do well in this.
For sure. I think that, one, you have to be able to communicate, which is a skill that some people say can't be taught. Mm-hmm. I think that it can be learned, but some people are obviously more adept to it than others. But as an athletic trainer, you are the number one advocate for your patient.
Okay.
Because you are typically there at the time of injury, all the way to the return to play.
Mm-hmm.
A lot of times you are the person with that patient every single day through their recovery time. You have to be their cheerleader. You have to be their mental health professional sometimes.
Yeah.
You have to be, you have to be their advocate. So, communicating within that process of care is extremely important. So every day you can communicate from anyone to the athlete, the patient, or their parents. Say they're a minor, or even if they're not a minor, they're still a kid. You know, if they're in college, you got to communicate with their parent successfully and tell them what's happening. And then you have to communicate to the physician, and you have to be able to do that quickly and effectively. And then you have to turn around and explain it to the coach, and explain it in the way that makes sense to them and their goals.
Yeah.
There's a lot of communication that happens on a daily basis, and you have to be able to be creative in your problem solving, and obviously have to be able to think quickly on your feet. Multitasking is a good one.
Okay.
You do have to be people-oriented, though. It is, obviously, it's a healthcare job.
Right.
You have to have good bedside manner, and you have to have some gumption, I think. There's a lot of tough spots that athletic training can put you in, decision-wise, pressure-wise, and so you have to be okay with that and know how to deal with it. And it takes time.
Yeah.
And it takes practice.
Yeah. When it comes to those tough spots and those tough decisions, could you give an example, either a personal one or something else, without obviously violating anyone's privacy or anything like that?
Yeah.
But just kind of general, what a tough situation might look like.
A really simple example, that's, obviously not life-threatening or anything like that. I used to work a lot of softball, in a very cold state. So, you have an athlete who is coming back from a grade 2, grade 3, pretty severe hamstring strain. Okay. Coach is using her as a pinch runner. Okay. So she's fast. She's coming back from a hamstring. Her only restriction is she has to get a really, really good soft tissue warm-up in, right? Dynamic warm-up. She can't go in cold. It's really bad for strains. It's really bad for soft tissue. But it's softball, so there's a lot of waiting around.
Yeah.
Okay. So you tell coach, head of the game, hey, listen, if you're going to put in so-and-so as a pinch runner, they have to have a minimum of 10 minutes.
Okay.
They have to have whatever, I don't remember exactly the time I gave the coach. And obviously in a softball game, if you're using a pinch runner, there's a reason it's called a pinch runner. It's in a pinch, right? So they're making decisions fast and quickly, and I'm making decisions that's best for the athlete. So they don't re-strain their hamstring.
Gotcha. Yeah.
Running bases. Okay. So that was communicated to the coach. Hey, listen, they have to get this amount of warm-up in. If they're going to be sitting in the dugout, they have to. And comes a time when coach calls in the athlete without any warning, and you have to make the decision. Am I going to piss off the coach, who, even though it was communicated with ahead of time, they don't care anymore. They're in the middle of winning a game.
Okay. Or
trying to win a game, right? They have their job to do, which is win the game. That's what a coach's job is.
Right.
Right? And so you have to make a decision. Do I make the best decision for this athlete's care?
Right.
do I risk them straining their hamstring again and then even digging myself into a deeper hole then because I didn't do what I know is best care, best practice, best prevention for that athlete, and then they're out however much longer, right? So in that moment, I was like, they're not warm. They can't go in. And so, you know.
Coach didn't like that, I'm sure.
No, but what are you going to, like, either you make a decision, you have to stick to your decision. And there's so many times where, you know, you are pushed to make another decision and you have to stick to, you know, what's best for the athletes and what's for the patient's care.
In a situation like that, does that mean that the athletic trainer, as the medical professional there, gets kind of the final say, or can the coach override you?
So athletic trainers do get final say.
Okay.
It really is dependent on the relationship and the culture you have with your coach, your athletic department. If your athletic director is going to have your back, those types of things. So whether or not your decision was actually best care, you know, is your boss going to have your back?
Okay.
Is the head athletic trainer going to have your back? Those types of things. So you have to weigh those options, and you have to know, you know, the relationship you have with the coach, and, you know, if you know that it's the best care practice for your athlete and the best option, you should stick to that. Obviously, there are times where you get pushed. And, yeah, typically athletic trainers do get final say in return to play.
Okay.
Yeah, return to play care. It doesn't mean you're not going to get yelled at for it or fight, push back, whatever.
Yeah.
But, yeah.
You got into athletic training. I mean, you started with that major in undergrad.
Yeah.
You went all the way through. You've stayed working in it this whole time.
Right.
You've changed industries, but you've stayed working in it. I know that this has been a lifelong goal for you, or not lifelong, but a very long-term goal to be in athletic training, to be an athletic trainer. Is this something, though, that people ever enter into later in life? Come around and they're like,
for sure,
you know, in their 30s or 40s or 50s or whatever, and
I mean, now that it's a master's degree of athletic training, you can have a undergraduate degree, bachelor's degree in a lot of different fields before entering a master's degree in athletic training. I've seen a lot of older people begin school for athletic training. So yeah, I've never seen someone, I think probably the oldest I've seen is 30s. I don't think I've seen higher go into it yet, but that might change with the progression of Masters of Athletic Training. It's only within its infancy years, that program is, and that education level, so who knows where it's going to go. But if you want to get into athletic training, if you're interested in it, there's a lot of good information out there. I think the biggest advice and the best advice I can give someone, which might also be the hardest, is find one.
Okay.
Find one and talk to one, because we're a small community. We're really big into networking. Everyone knows everyone who knows everyone who knows someone, right? So the best option is to find someone and ask if you can shadow them.
Yeah.
See what it's like. See if it's something that you're up to doing. Whether it's there's so many different facets you can work in, from clinic to hospital to industrial to military to performing arts, like we've talked about this.
Right.
So it doesn't have to be the traditional college or secondary school. There's so many different facets you could get into. The other thing is the National Athletic Training Association website is a really good resource. I get most of my resource information from there. It's obviously our national association. If you want information on education programs, how to get certified, the Board of Certification, the BOC, or the CAATE, CAATE accreditation program.
Okay, amazing.
To find what program you want to do, where in the world offers athletic training programs.
Yeah.
So yeah.
Okay. You said where in the world?
So I have colleagues who are working on getting dual accreditation, dual certification across other countries. In other countries outside of the U.S., we're known as physiotherapists, most commonly. But yeah, I've had some great international experiences with physiotherapists, and obviously there is a bit of a difference in between certification tests and examinations, and you have to take those in order to. Unfortunately, there isn't one exam that allows cross certification right now.
Okay.
That would be amazing if that could happen in the future. But I've worked with some great international physiotherapists. I've worked with, and even got to go to school.
Yeah.
There, so yeah,
it's amazing.
Mm-hmm.
Is there anything that we kind of haven't covered yet that you wanted to tell the people?
Tell the people.
Yeah.
Pay athletic trainers what they're worth.
Yes.
We are healthcare professionals, and we're highly knowledgeable in so many different areas and so many different fields, and we should be paid what we're worth.
Yeah, I agree. Pay Hannah more.
They appreciate that.
Yeah. Okay. Well, I guess that's it for today.
Awesome.
So, I hope everyone has a happy and healthy day.